9B, review of and discussion on Sugarland Fire-EMS Department organizational assessment findings and recommendations of the comprehensive assessment conducted by the Center for Public Safety Management, LLC. Ms. Raina Varghese, Strategic Initiatives Director, and Mr. Mike Iacona, Center for Public Safety Management. Mike, welcome.
Good evening, Mayor and City Council. The objective of this workshop is to provide a brief overview of the role of the City Sugarland Office of Strategic Initiatives, or OSI's, role in organizational assessments, and also to review and discuss the Fire-EMS Department's organizational assessment findings and recommendations by the Center for Public Safety Management, LLC, or CPSM. So what is the role of the Office of Strategic Initiatives, particularly with departmental or organizational assessments? What we do is we help align the core values of always striving to get better as an organization through the various methods of reviewing both procedures that use data. And examples of such are organizational departmental assessments, City Council goal measures, which you all are very familiar with, and also operational performance measures and departmental business plans. So this particular workshop is going to be focusing on simply organizational assessments. And so there are various methods of how we conduct organizational assessments. They're conducted in-house by OSI staff, contracted services, depending on the subject matter expertise required, and then both they can be contracted as well as conducted in-house through a combination effort. So the purpose of assessments are, there's varying purposes of why we conduct assessments. The first and one of the major factors is accountability, also identifying processes and procedure enhancements or efficiencies, customer service enhancements, but also to look at resource alignment and how they align with the city's mission and values, conducting cost-benefit analysis, also help foster innovation and how to look at ways to do better, review best practices and benchmark analysis, continuous improvement, all which help us to seek ways to continually strive to help us do better as an organization. So an assessment was completed earlier this year with the Sugarland Fire and EMS Department. First, we were contracted with CPSM to do an in-depth analysis of the overtime usage within the Fire EMS Department back in May of 2016. And then we took on a full assessment with CPSM to conduct back in July of 2016 with the Center for Public Safety Management. And the Center for Public Safety Management, or commonly referred to as CPSM, is now the exclusive provider of public safety technical assistance for the International City County Management Association, or ICMA. CPSM has considerable experience in fire departments, career, combination, and volunteer services. And we, as a city, has been working very closely with Mr. Mike Iacona from CPSM. He has a background he's a retired fire chief for Flagstaff, Arizona Fire Department, and also the former director and fire chief of Orange County, Florida Fire Rescue Department. He is here today to present the fire department's recommendations as well as the findings. Also, Assistant City Manager Steve Griffith and Chief Adami are also available for any follow-up questions. I'm going to turn it over to Mr. Mike Iacona.
Good evening, Mayor, members of the City Council. It's a pleasure to be here. I really enjoy your town, and unlike the more sobering report that you received regarding the legislative session, my report will be much more positive, I can assure you of that.
We need that.
If I could figure out how to do this. Here we go. As Rena said, we're an affiliate of ICMA, the International City County Management Association. I'm going to try and move through this. It's getting late now. I was a project manager on this project, both projects, and we have a extended staff that assisted throughout the process. Tonight we're going to give you an overview of our methodology. We'll talk about our observations with regard to this organization. We'll review some of the key findings and recommendations of the study and then open it up for some questions. The project began with an in-depth review of the financial situation, particularly focusing on the overtime. We had a series of on-site visits talking with members of your staff both in June and October of this year. A series of recommendations were provided that have been considered and many of them implemented. We also looked at the workload of the organization, the types of activities that they're doing, how they're adapting to the new involvement with regard to EMS and EMS transport. And there was ongoing communication with staff to really hone in on the issues and ensure that our findings were accurate. In terms of our observation, and here's the real positive aspect, this is an exceptional organization. I've reviewed hundreds of organizations throughout the country, and I could tell you that Sugar Land is in the top 10 of those organizations. And what was even more startling and encouraging was the level of enthusiasm in which the recommendations were accepted and implemented. I felt that before I even left on some of these visits, they were implementing some of these changes. It was something that I had not encountered before, and it's truly a tribute to, I think, Chief Adami and the administration and your leadership. But I think the real drive in this organization is that desire for customer service. From the grassroots employee up through the ranks, customer service is number one. And it's a tribute because sometimes that's lost in this business. Sometimes people forget that they're serving the public. And in this organization, that certainly is not the case. You did undertake EMS transport a few years ago, and that was a very abrupt change to the organization. It changed the whole dynamics of where your focus was. It created new structures. It created new deployment strategies. It injected a billing and financial component that's quite honestly difficult to undertake. And this process was an evolution of that change. There were unanticipated overtime costs, and I think the real driver for that was there was a sense of not wanting to fail, that there was an overcompensation, being extra conservative in terms of having the resource base to provide the type of coverage and incur those costs. There's definitely a need for some improvements in the dispatching component, because the dispatching element is key to the process, where there's an actual dissection or an analysis done of the call before it's dispatched to determine if it's an emergent call or a non-emergent call. The key point here is that most calls are non-emergent. In many systems, 85% of these calls are truly non-emergent. So how you dissect them and how you deploy your resources for these public assist, these service calls versus the true emergent calls really dictates, your deployment and your overall efficiency. There needs to be some adjustment to those response protocols so that when you know it's non-emergent, you send units in lesser numbers and you send them at a non-emergent pace. They're not running with lights and sirens, going through intersections. They're traveling with the speed of traffic. They're stopping because truly they're not emergent. They don't need to do that. And it's a hazard if they are traveling at those speeds. We recommended that there be a working supervisor added to the organization, an EMS captain. Again, it's a workload issue, it's a coordination issue, it's a facilitation issue, a change in dynamics, and we felt that position will assist in the overall process. The call screening effort needs to be improved, and we recommended that there be some adjustments to the city council response goals. You had established some goals a year ago. We've put some real-time measures in there, and those numbers were off. And it's very, very common to see that. When you actually see the actual, it's different than what you're projecting. And there's nothing wrong with the system. It's not a reflection that it's not meeting a certain standard. The standard is very high. It's just that you have a deployment in a organization or a service area that takes time to get to. So you can't achieve those faster response times, but the outcomes are not negative. Some methodologies to reduce the overtime dealt with the number of people that were allowed off on vacation. We suggested a reduction in those numbers. We also suggested that there be an audit with regard to the staffing process, that there be a review from an outside entity to ensure that the personnel practices are in compliance with your city regulations. We suggested the removal of the power unit. This was an additional unit that was put in service on a part-time basis to deal with transports, and we felt that that could be eliminated. It was being funded 100% by overtime. We suggested the cross-staffing of some of your units so that the same people would staff either an ambulance or a fire truck depending on the call type. Again, a method to improve efficiency. We also suggested that you alter the response of your ambulances when they're minor calls. Don't put these key units on those calls that are not in need of those high-level EMS service units. We suggested a change in the minimum staffing process when there's overtime supporting that, so that the nighttime staffing would be less than the daytime staffing when there's a corresponding reduction, significant reduction in the call activity. Again, the adjusted response for non-emergent calls, and we also suggested that you continue in obtaining hazardous material response, the higher level of hazardous material response from regional providers. You're fortunate that you have two very active teams in the area that can respond for this technical type service. Training, we suggested a consolidation of training, EMS and fire training under one umbrella, some other functions under training to give it more structure, more organization. Again, some of the efforts towards training. In terms of prevention, we highly recommended that the units get into some of these critical infrastructure to familiarize themselves, to do some fire prevention inspections to ensure that compliance is being met. That's the company inspection. And also that you fine-tune your ability to do damage assessment and fire loss assessments, a key measurement as to the fire problem in this community. Again, some fire prevention ideas. Also looking at a cost recovery method for some of your inspection services so that they could increase and decrease on the basis of the building activity in the community. Again, many of the recommendations have been implemented. With regard to the overtime issue, overtime was reduced in the current budget by over $250,000, and year to date, you're tracking less than that amount. So there's significant improvements in the overtime. An interesting thing with regard to a number of recommendations, there's a chief's assessment process that's taking place where internal candidates are being considered to replace Chief Adami. And as part of that assessment process, they've assigned a number of our recommendations to give them an opportunity to explain how they would do that, how they would indoctrinate, or if they would reject that recommendation. I think it's an excellent, excellent approach to both taking a good look at these potential candidates and getting some good ideas on how to implement some of these issues, because they do have some complexity. Again, Sugar Land's an excellent organization. It was excellent when we got here, it's excellent today, and it's only getting better. So, I mean, you can't say anything more about an organization. I commend you all. I commend Chief Adami and his staff. It's been a pleasure working with you. And with that, I'll answer any questions.
Thanks, Mike. Mike, what we may do, Chief Adami, Chief Steve, would you guys like to say something, and then we'll open it to questions? Chief, I'm not going to let you leave till we get through this special session. You're not going anywhere.
Well, we certainly appreciate the effort of Mike and his team. It really taught us a lot in the use of our data and analytics. It's by far the most comprehensive process that we've ever participated in, and we've learned greatly from that. Thank you, Mike.
As Steve said, it's been a learning process in some areas. Some areas we knew some of the issues that we were going to be addressing. And that's been a great asset for us in that Mike has been able to come in, and also some of the things that we're doing well, and some of the things that we knew were going to have issues that, he offered some insight into some of those things that we were looking at. And the last thing I'll say is my chief officers have been really working real hard at this. They've taken responsibility for some of these and have done excellent work in the way they've gone about researching it, the way they've collaborated as they've looked at these issues. So I'm real proud of the work that they're doing and of the organization.
Thanks, Chief. Chief, it was into the senior, I know you've got some of your senior management here. The thing that struck me, Mike came up and introduced himself when we had the recess, and what he said was, he said, I was more or less blown away, those are my words, by the fact that you guys were implementing stuff before he left. Matter of fact, he made that comment to us, and that's the true measure of an exceptional organization with people, is that you can recognize that there are weaknesses and move to fix them. And so, Mike, thanks to you. Chief, thanks to you and your senior management team for the way you embraced the recommendation. Counsel? Steve?
Thank you, Mayor. This is a question for Mike. One of the issues we have as a city is we don't have any support from the state government requiring businesses in our city to report what they have in terms of hazardous things that our fire department men and women may face when they go into a building. Is there any statewide interest in somebody pursuing that at a state level to where we can sign on to it? Or what's going on with that? Are we the only ones that have that problem?
No, and it's a problem that exists nationally, because you never know what people are doing in the various occupancies that they inhabit. But the key to that is getting those units in there to, number one, familiarize themselves with the clientele, introduce themselves to the management, understand the processing, the storage, identifying any problems before there's an issue. So that in-service inspection, having those engine companies walking around in these facilities is the best approach to this, aligned with your code compliance issue. The codes, the fire codes today are extremely effective. That's why the number of incidents that we've seen nationally have plummeted in terms of the actual number of incidents. Take fire sprinklers, for example. Fire sprinklers are probably 98% effective. That means that if there's a fire in a sprinkled building, that sprinkler system, which you have here, that little white thing over there next to the light, it will pop down, and usually 1 or 2 heads will put out the fire. In the 2% of the times that they're not effective, it's because we screwed around with them. We painted them, they broke, and we didn't fix them. Something happened that we caused them not to work. So the codes and the built-in protection are extremely effective, and the codes are updated regularly. So it's key, and your organization is doing that, adopting the appropriate codes. But getting those units into those facilities to understand what they're getting into before an emergency and to curtail problems before they could turn into bigger problems.
So, follow up, Mayor.
Follow.
So do we have the legislative or regulatory ability to force them to open the kimono, so to speak?
Absolutely. We have the right of entry on commercial and multi-occupancy residential units. And usually the codes are more stringent in those areas that if someone causes a problem, it will impact someone who, unbeknownst to them, is adjacent to a problem. So the codes give us the ability to access these facilities for the purpose of protecting others. So we have that right of entry. We're one of the few entities that do have the right of entry on a regular basis without subpoena or things of that nature.
Follow.
So where are we with regard to our business park in terms of knowing what's in it?
These are one of the recommendations that they jumped on before we left.
As Mike said, we have, the fire marshal's office has an inspection schedule that he undertakes throughout the year. And, for example, the business park, a lot of those businesses change, and a lot of businesses remodel, and some of those we're not able to catch unless we know something is going on, or if we get a complaint. The fire marshal will send somebody into these buildings to inspect these buildings and ensure that their code requirements are met. We do have a very robust code system in place. No new building in this city opens or gets signed off unless the fire marshal is involved in that process. But one of the areas that Mike was alluding to was getting engine crews and into these buildings. We're taking a look at that right now. We're taking a look at that, how we can make that or develop a program that will not only make sure the crews get in there, but also that they're prepared to go in there and take a look. Remember, these are fire crews. These are crews that don't normally do inspections, so we want to make sure that they're properly prepared to go in there and take a look at some of these inspections. In order to conduct fire inspections, fire inspections in the state of Texas, they have to meet certain qualifications and certifications. So we don't necessarily want these crews up to inspector certifications, but they should be able to go in there and be able to identify hazards and then make those reports to the fire marshal's office, and he can follow up. So we're looking at that process right now and developing. See how we can develop it to meet those challenges.
One final, please.
Final.
So the state is not required when they issue a license to a business in our business park to have some sort of material. They're not required to notify us. And would I assume that given these inspections, we don't need to press the state to tell our fire department when they issue a license?
You know, you heard the report prior to this. It's very tough to get those type of requirements into state legislation. I mean, you take the home sprinkler issue, for example. That's been a very tough issue in the state, which, you know, if we could just get those installed, we could probably reduce fires in the home to almost nothing in new construction. But that's very difficult. That would be very difficult to do.
Okay, thank you.
Amy.
Okay, I want to preface this with, I'm so proud of our fire department, and I do agree with you on the caliber of people we have within the fire department. They're proactive. They don't need to wait for an alarm. They show up at a fire just because they see smoke, and I know this from personal experience in my neighborhood. But I do have some questions with regard to your findings, and I'm going to try and consolidate them so that I don't take as long, because it's almost 9 o'clock. You said the city council's goals were not, I think, realistic or something along those lines. So Is there a national standard? If so, what is the national standard? How far off were we? And what is the recommended goal? And is there a different standard for fire versus EMS? So that's me trying to consolidate a lot of questions in one, and then I have some more questions after that.
There are advisory guidelines with regard to response time. And that response time criteria is very similar for fire and EMS. It's typically a 4-minute travel time for the initial response. And that's for 90% of the calls. Now, that is not a mandate. And there's a number of standards that also say that your deployment strategy should be based on local conditions, that you should look at your community and make the determination of what's right for your community. If it's an older community where there's demographics that are resulting in a lot more incidents, obviously the deployment needs to change than if it's a more dispersed, larger, single-family structures that typically don't have these large-scale fire events. Your response time can be adjusted. So our finding was that the standard that you had applied was a standard that was not based on outcomes. Okay, and once we looked at your outcomes, there was a difference there, and we suggested that you change your recommended goals to measure what you're capable of doing. Now you have a city that's approximately 80 square miles, and that means that each fire station is covering about 10 to 11 square miles. And a fire truck or a rescue truck, they don't travel as fast as you think. You know, they only travel about 30 to 35 miles an hour, even when they're going full bore with the stopping and the turning. So that means they could only cover about a mile every 2 minutes. So you start marching out a service area that's 11 square miles, you know, it's going to be hard to get to that periphery area. And you have to ask yourself the question, what is the outcome of what our response time is? And your outcome is very positive. So that's why we said, you know, base your standard on what you're doing because your outcomes are not negative. I mean, that doesn't mean that there can't be room for improvement. There could be improved deployment in terms of how you're managing the dispatching of resources, how fast it takes people to get out the door, but you're not going to change that travel time because that's still going to be 35 miles an hour, and if you're going 5 miles, it's going to take you 10 minutes to get there.
So is that your recommendation, that it takes 10 minutes from the point the call is received to the time that they arrive? I'm just looking for, okay, you just said 4-minute travel for 90% of calls is a national standard. So what are you telling us our standard should be given the parameters you just discussed?
We're saying, now that's travel time. There's two components that are added to travel time. There's the dispatch handling time. That's the time it takes for someone to call 911, for them to interrogate the caller, and then for them to notify the responding entity. In your system, that's taking 2 to 3 minutes, okay? Then there's the time that once the fire unit gets the message, they receive it, they don their protective gear, they start up the trucks, and they go en route. That's the turnout time. That's taking sometimes over 2 minutes. So you've got close to 5 minutes before the unit is responding. And then your travel times are in that 5 to 6 minute range. So you're seeing a 7 to 8 minute total response time for the majority of your calls. And that's okay.
That's what I'm trying to find out. Now,
That's okay.
2 to 3 minutes for dispatch sounds slow to me.
It should be a little better. And we
Okay.
recommended that there be some reporting, some measurement, some expedited processing. There's a thing called a pre-alert. In other words, they start getting the call, and then they'll send the unit while they're still collecting that information. It speeds up the process. So there's things that you could do to improve it, but some of the things, you would have to build 3 or 4 different new stations.
Well, and I understand travel is impacted by the number of vehicles on the road, but dispatch seems like there should be some way to not make it be 3 minutes.
That standard is about 1 minute, 80 seconds if they're doing a full interrogation.
That's standard, but we're not at standard. So that's one of the things you recommended
Yes,
fixing,
yes, ma'am.
basically. Okay, now, you said that your recommendation was improve service delivery. Is that what you're talking about in terms of improving service delivery? What do you mean by improved service delivery?
Again, because there's a range of services that are being provided, there's a number of ways that they can be improved. Performance outcomes. One of the measures that I think is more important than response time is when you look at the paramedic and you say, how effective is that paramedic in starting an IV? Is he getting them 80% of the time? Is he getting them 50% of the time? That's a measure that you could truly impact service outcomes. Intubations, adhering to the treatment protocols. Again, these are all performance outcomes that truly show a benefit in terms of patient care. All right? Fire loss is another area. Are you looking at your fires from the perspective of, what type of stop did you make? How much fire loss was minimized? And then, are you looking at your fires in total and analyzing them and saying, okay, we're having problems with rental apartments. 70% of our fires are in rental apartments. Let's focus on rental apartments. Let's do our inspections. Let's make sure that the fire extinguishers are working. Really direct your efforts on the basis of an analysis. Those are some of the ways to improve outcomes.
Okay, and that makes sense. One of the things I was very concerned about when I first got on city council was every single call we sent out a fire engine. Have you recommended that more ambulance, less fire engine? Is that one of the recommendations you've made?
And we made the recommendation that these fire engines be cross-staffed with rescue companies so that they're operating 2 different types of vehicles. So if it's an EMS call, they would get on the EMS unit. If it's a fire call, they get on the fire unit.
Okay, and you mentioned that the overtime has been reduced by $250,000. I think it was well over $1 million, the overtime. And one of the things that I had a concern with, that was astronomical. That was a scary number, and it went on for a while. But the firefighters get used to having that overtime. That then affects morale. And did you at all address morale issues in your analysis, or that just wasn't a consideration?
Well, we had conversations. We met with the employees. We visited the stations. We explained some of the issues with regard to why we were there and what we were looking at. Sure, there's the issue of, a change in the amount of monies that are being dispersed. But that was a problem. You can't have unlimited expenditures when it comes to government. You have to operate within a budget. The point that I made that I thought was extremely positive was that from last year's overtime budget to this year's overtime budget, there was a reduction of over $250,000. So they earmarked $250,000 less for overtime in the current budget. And then when you look at the current budget to date, they're tracking less than, the full expenditure. So in roughly 2/3 of the year where you are right now, they're probably about 55 to 60% of that expenditure.
Hey, and I guess that's my last question, because maybe other people have questions. in terms of overtime, just like we have a goal for response time and we have a goal for dispatch time, there's always going to be overtime because I don't think you can get away from it. Is there a goal for the amount that overtime, that's reasonable overtime under what we have?
I don't know what that is. It's somewhat of a moving target, but I can assure you that it can be reduced, and it can be reduced without a negative impact in terms of service delivery. To what degree it can be reduced, I think, is a product of your administration. And I have the utmost confidence that they will gauge that to the right point, that there's sufficient overtime to ensure that the coverage is there, but it would certainly be a reduction from where it was.
And part of that sounded like it would be reducing overlapping vacations or whatever, so you have more men who are available because the overtime occurred because there weren't enough people to
Right.
man the station.
Well, the power unit was 100% overtime.
I don't even know what a power unit is.
Well, it was an extra transport-capable unit that was operational, I believe, 12 hours a day. And it was funded solely by overtime.
Yeah,
So that's gone now.
okay.
So that's going to significantly impact overtime. And then if you look at deployment levels so that your minimum staffing is lower at the nighttime when you have less calls and higher at those peak period of times, that's going to reduce overtime also.
Well, I appreciate the hard work. I also, Chief Adami, really appreciate your responsiveness to the recommendations and jumping on it before he even walks out of the building. That's great, because that's what we needed to do, and I truly appreciate it. And all of you back there, thank you for everything you do, especially being here after 9 on a Tuesday night. We appreciate your making our city one of the safest ones we have in the state of Texas. Thank you.
Mary Joyce?
Hi. Quick question. You had mentioned hazardous response, that we have 2 other groups that we can rely on. What groups are those?
There are hazardous material teams in the city of Houston.
Okay.
And there's a hazardous material team in both Harris County and Fort Bend County.
Okay.
So you have different resources for these less frequently occurring events with a reasonable, now your responding units are trained at that first level of hazardous material interaction. So they're fully trained and qualified to really know what the situation is and then make that determination if a more technical group is needed that they could then call in.
That's just, it was news to me, and I think it's very positive. I have full faith in the capability of our fire department, but knowing that we do have a business park, we do have NALCO, that we have that backup. One final kind of question, comment. I think of all areas, dispatch has got to be tough. Because even though we know statistically maybe 85% are non-emergent, I think anyone calling 911 would consider it an emergency. And that's what that person on the other end is getting, this, person who's scared, and saying they need help immediately. As it relates to, did you have specific recommendations? Is it additional training, or is it new technology that perhaps we may need to implement that could help in that response time?
I think it's more a question of following the guidelines that are in place. They have dispatching protocols, and in that dispatching protocols, they call them emergency medical dispatching, where when the caller makes a call, they have a series of questions that are asked. And depending upon what answers are given, it tracks the call either into emergent or a non-emergent category.
Okay.
And then on the basis of that determination, the dispatch is adjusted accordingly. So there's methods in which they can track or do some quality assurance. Are those questions being asked and answered properly? And that's a measurement. And then how fast are they doing it? Is that being tracked and measured? So we said We need to ensure that the dispatching protocols are being adhered to, that they're being reviewed through a quality assurance process. You're getting reports on that, and you're getting reports on how fast these calls are being.
And I'm sure that's one of the items that was starting to be improved even before you left.
Mr. Mayor,
Yeah, go ahead.
if I could
minute.
add to
Yes.
that also, and Steve or Shannon,
Yeah.
you may need to help me. Aren't we adding an additional dispatch station as part of the annexation budget that significantly enhances our capacity within dispatch?
Yes, sir.
And that is, we literally, if I remember correctly, we're at a point where the annexation budget pushed us to the point that we had to add a whole new station.
Yes.
And can you talk on that for just a
Right.
second?
I'm Shannon Price. I'm the Director of Public Safety Dispatch. We added 8 new positions with the annexation budget, and that's going to be enough people to staff another position full-time in the dispatch center 24/7. But I just would like to clarify our dispatch times. I thought that didn't sound quite right, and so I was looking up some statistics I had. So for the fiscal year last year, we dispatched 91% of our emergency fire and EMS calls within 90 seconds.
Wow.
So we're actually a little faster than, sometimes we do go 2 and 3, and there are several reasons that could happen. We could have, a difficult caller, we could have a language barrier, we could have a issue with getting, a proper location in order to dispatch them out. But we also do have a quality assurance program, so we are checking to make sure that we're following the proper protocols. One of the things that he did mention was where it can tell us if we have an emergent or non-emergent call. That's where we have a little bit of a breakdown between our EMD system and our computer-aided dispatch system. So that's something I've been working on with the computer-aided dispatch vendor to get that remedied, and that's going to help in letting the responders know if they've got an emergency call or not.
Thank you. That really that helps a lot.
Okay? Thank you.
Thank you, Shannon. Thank you, Steve.
Anyone else? Thank you, Mike. Thank you, Chief.
Thank you very much.
Thank you, Mike.